Tonsil stones may be a term that you've heard in passing, but never knew what they were. You may get them yourself, but don't realize it, or it only happens once in a while. Tonsil stones, or tonsilloliths, are relatively harmless and can easily be treated at home. What are tonsil stones? Tonsil stones are little calcium deposits that build up on the mucous membrane coating of the tonsils. Sometimes dead cells, mucus, and even food can get stuck on the tonsil, forming this stone. Usually, the stone is a harder texture that can either be white or yellow. They tend to stay the size of a grain of rice, but they can grow to the size of a small grape if there's enough buildup. If you have large tonsils or repeated tonsillitis, they can be more common. How to tell if you have a tonsil stone? Most tonsil stones don't do much. They form, dislodge when something knocks them loose, and you're none the wiser. However, some potential symptoms can be filled circle, your throat feeling irritated or like you have something stuck. Filled circle, you're having trouble swallowing, or your throat is redder than normal. Filled circle, you have bad breath. Filled circle, white bumps have formed on your tonsil. Filled circle, you have ear pain, which means a tonsil stone has formed near a nerve. Filled circle, your symptoms mimic tonsillitis except for a fever and a headache. How can you prevent them? If they're persistent, you can discuss with your doctor about having a tonsillectomy. However, you need to have at least 7 cases of either strep throat or tonsillitis a year to meet the criteria for a tonsillectomy. If you get them now and then you can. Filled circle, practice good oral hygiene by making sure you brush your teeth and tongue every morning and evening as well as after every meal. Also, you should floss. Filled circle, use alcohol-free mouthwash to flush away bacteria and debris that your toothbrush didn't get. Filled circle, gargle salt water to keep viruses and bacteria from getting to your tonsils. It also acts as a pain reliever that some tonsil stones cause. Filled circle, use a water pick to flush out any additional debris and bacteria. Can you remove them at home? Yes, if they are small stones. You can gently scrape them off with a toothbrush or cotton swab. You can also remove them by gargling salt water or using a water pick. When should you see your doctor? Usually, tonsil stones aren't severe, but if symptoms persist, then you should see a doctor. These symptoms could include having red or irritated tonsils as well as ear pain. You should also see a doctor if your tonsil stones are frequent. There could be an underlying issue causing them.